Greetings, everyone. I want to welcome you to our event today. My name is Tracy Brown, and I am the curator of the Same Game Different Smokers exhibition, as well as the project manager for the African American Tobacco Control Leadership Council. On behalf of our leadership at the AATCLC, I want to welcome you to our event, The Culture of Manipulation, today. I want to share that I am absolutely overjoyed that we have had such a wonderful turnout for such an important event. This is a hot button issue, so we have folks who are attending from all over the world. So we want to be sure to just let you know how important you are in the fight to keep all people healthy and nicotine free. And we appreciate your presence here today. We want to welcome our members of the African American Tobacco Control Leadership Council, our beloved partners in this work, as well as our fellow organization, Amplify. As in addition to the Amplify community partners, we also want to welcome our friends from the Loop, led by our very own beloved Dr. Valerie Yerger. We also welcome our friends from the Center for Black Health and Equity, who are always fighting the good fight, and they are the originators of uh, No Menthol Sundays, which is an event you'll hear a little more about later. We also want to thank our community partners like the dynamic women of Delta Sigma Theta Sorority Incorporated, as well as our work partners, the Action on Smoking and Health, the Public Health Law Center, the American Cancer Society, as well as the American Heart Association and the American Lung Association. We want to thank our other partners like Stanford Health, as well as the representatives who are here from PAVE and the Campaign for Tobacco Free Kids. We want to thank our public officials who are leading our communities, leading our cities and our counties and our states and our countries in making healthy decisions for our most vulnerable populations. We welcome the members of the representatives from the Hawaii Attorney General's office. We also welcome our friends from the San Jose City Council. We welcome folks from the city of San Diego, as well as the city and county of Los Angeles, and the city attorney's office. You are more than welcome. And the governmental officials from around the country and around the world who are here today. We also want to welcome folks from the educational institutions who are doing the important work of helping us to continue educating people about this important issue. We want to welcome our friends from the public health departments all over the state and all over the country who have registered today, as well as the members of the press who have come out to help us spread the word about this important issue. I want to give a extra special shout out to my fellow artivists who are here today, as well as the teachers who are so concerned about their students. They're figuring out what to do and how to talk to our kids and our young people about this issue. So we welcome you. And last but most certainly not least, we want to welcome the members of the tobacco industry and the hookah lobby. We know you here. So welcome. We hope you change your life and change your behavior after you hear the information that we have to share here today. So without further ado, I am going to turn things over to actually, I take that back with a little bit of ado. Further in my welcome, I want to make sure that I let you know who you're going to be seeing here today. So first and foremost, we have, of course, the co-founders of the AATCLC. We have Carol Magruder, who is a seasoned veteran of California's tobacco control experience and a founding member and chairperson of the AATCLC. She's received many honors and accolades from organizations including the Public Health Law Center, SRNT, the American Legacy Foundation, and the San Francisco and Berkeley branches of the NAACP. She also served as the NAACP branch president in Berkeley for more than 2 terms. Also speaking to you today will be Dr. Philip Gardner. His he is a public health activist as well as an administrator and evaluator and researcher. He recently retired from a long career with the Tobacco Related Disease Research Program at the University of California in the Office of the President, where during his distinguished career he worked on studies ranging from hypertension, multiculturalism, AIDS, to breast cancer and prostate cancer, diabetes, and smoking. For the past 20 years, Dr. Gardner has lectured around the country on African American health disparities and in general, and menthol smoking in the Black community in particular. Dr. Gardner is currently the co chair of the AATCLC. Coming to you today also is Dr. Stephen Milner. Now, he has a special place in my heart. He was one of my professors at San Jose State. So he is a beloved professor emeritus at San Jose State, and he earned a degree at San Jose State before attending UC Berkeley to earn a doctorate in sociology. He's the senior editor of a recent book called California's Changing Majority: Historic and Contemporary Dynamics, and which is now in its third edition. And he was the among the first African Americans to teach full time at the University of Mississippi. He also served as chair of San Jose State's African American Studies Department for many years, and he is a beloved community figure. So, welcome, Dr. Milner. We also want to welcome Dr. Wael Al-Delaimi. He is a multidisciplinary epidemiologist with a medical background um, in chronic diseases and tobacco and diet and the environment. He practiced medicine in his native Iraq and then Jordan between 1991 and 1995 before finishing his doctorate, his PhD at Otago University in New Zealand in the year 2000. He's been involved in tobacco control research for more than 25 years and led the tobacco control surveys, and more recently leads the California American Indian Tobacco Initiative evaluation. His tobacco research focused on biomarkers, policy, hookah, and e-cigarettes. So we have quite a authority on the subject matter here with us. And Dr. Al-Delaimi, welcome. We are also welcoming Dr. Arnab Mukherjee. He's an associate professor and incoming chair of the Department of Health Science and and Community Health at California State University, East Bay, previously known as Cal State Hayward. Dr. Mukherjee's applied research interests broadly revolve around using community engaged methods to understand and address health disparities among understudied Asian and Pacific Islander subgroups. He has a particular focus on contextual and culturally framed risk factors among South Asians in the United States. So, Dr. Mukherjee is going to be moderating the discussion between our scholars' little letters. So, we're so happy to welcome you here. So, without further ado, now I will hand things over to our co chair, Carol Magruder.